Hi, my name is Hannah and today I'll be presenting on iodine. So I'll be covering history, food sources, function and metabolic function, symptoms of deficiency, and symptoms of toxicity. So iodine is an essential trace mineral. Prior to the 1920s, Americans suffered from goiter disease. Goiter is an enlargement of the thyroid gland caused by iodine deficiency. This epidemic of goiter disease caused a campaign for mandatory iodization of salt. Salt manufacturers were quick to add iodine in their products, and this decreased goiter disease among Americans. Some good food sources are iodized salt, seafood such as seaweed and fish, eggs, and dairy products such as non-fat milk and yogurt. The RDA for men and women is 150 micrograms of iodine daily. An example calculation for finding RDA for iodine would be if you consume 3 ounces of cod, which would be 146 micrograms of iodine. You would take 146 and divide it by 150, and taking that, you would multiply it by 100 to get the percentage. In this case, that would be 97% of the RDA for iodine. As it pertains to how much iodine you need to take for your age or for if you are pregnant, when you're younger, you will typically have more iodine microgram consumption needed. Also, if you're pregnant, you need to have more microgram of iodine needed. For example, from 7 to 12 months, you'll need 130 micrograms of iodine. If you are pregnant, you need 220 micrograms of iodine. Metabolic function. Thyroid glands turn iodine into tetraiodothyronine, T4, and triiodothyronine, T3. Approximately 60% of your thyroid hormones are actually composed of iodine. These thyroid hormones will then regulate your metabolic rate, reproduction, nerve muscle, and heart function. As it pertains to metabolic rate, these thyroid hormones control the rate of ATP production and the TCA cycle for all your cells. Deficiency symptoms. Some deficiency symptoms of iodine can be a goiter, hypothyroidism, which is when your thyroid doesn't make enough thyroid hormone. If you are pregnant and you have chronic deficiency, you can also pass cretinism to the infant, also known as congenital hypothyroidism. Cretinism is an abnormal mental and physical development. Toxicity symptoms. So these symptoms can be similar to deficiency symptoms, things like goiter, hypothyroidism, and elevated TSH levels, but there can also be other symptoms, including iodine-induced hyperthyroidism, thyroiditis, and this is rare, but you can also get acute iodine poisoning. Overall, iodine is an essential trace mineral. The thyroid converts iodine into thyroid hormone. In fact, 60% of your thyroid hormone includes iodine. Knowing this is important to the metabolic function because this will control the rate of ATP and the TCA cycle for all your cells. Some good food sources of iodine include seafood, iodized salt, and dairy products. If you wanted to find the percentage of RDA for iodine, you would take the microgram amount of iodine you've consumed, and you would divide it by the daily amount of micrograms you need for the RDA. That would be 150. Taking this result, you would multiply by 100 to get the percent. If you are deficient in iodine, you can also receive symptoms like a goiter or have hypothyroidism. If you are pregnant with deficiency, you can also have a miscarriage and give your infant cretinism or growth retardation. If you have iodine toxicity, you can have symptoms similar to deficiency, or you can even have hyperthyroidism or thyroid papillary cancer. These are my references. Thank you.